Hi everyone, I'm Boylston. I'm a pediatrician and managing partner at Burlington Pediatrics and Pediatrics. And I'm very excited today to share my practice's journey in the past year in implementing a wellness program at our practice. This, incidentally, is a picture of Linville Falls. My family and I went there about a month ago. And it really evokes, I feel well when I look at this picture, and I hope you do too. It's very positive. I'm also an aspiring photographer, and now that I've conquered Leadership College, I hope to win a month in an upcoming Medical Society calendar photo contest. So, a little plug for that. This is me, and I'm smiling. I love my job. I really enjoy what I do, but I'm also very much like one of the over 54% of physicians who experience some symptom of physician burnout. And that's according to a 2014 Mayo Clinic study. Just like you guys, when I feel burnout, it's not an insular experience, right? These are the other people who feel it too. So these are some of my coworkers, just a few. We actually are open to hiring males, so this just happens to be just a little snapshot of our team. And I know that even on paper, if I should have a bad day, these are the people who can make it surprisingly good. And so we get through the day together. And so if I'm having a bad day, it translates to everyone else. And so for me, physician wellness is very much tied with team wellness, practice wellness as our group. And so in addressing or in brainstorming what I wanted to accomplish this year with my Leadership College project, I wanted to make sure that it was relevant and very self-serving in that I really wanted to help these people here. So the concept of implementing a wellness program at our practice, it started fairly early on, conceptualizing kind of what did I want to do, what would be meaningful for our group, and then there was a meeting of the minds in early February, and our practice is so supportive. There are so many people who have positive energy. Our motto is actually be positive, be professional, in the BP, Burlington Pediatrics. So that's how everyone remembers that. But I said, hey, let's do this. What do you think? And we just brainstormed, and there were just so many good ideas that came from it. But we had some very definite things that we needed to accomplish. Our practice is, it's fairly large, so it's a moderate-sized practice. It's independently owned. We have over 50 employees, and we have 12 providers and 3 offices, and we knew that we really needed to include everybody. It had to be something practical, and we don't have the resources to hire somebody to do this. We still change our own light bulbs, so this really had to be something that we could do as a team. So the first criteria was it really had to be inclusive. It had to be open, non-judgmental. You hear about wellness programs and you think all of a sudden my employer is going to know my weight, my blood pressure, they're going to be all in my business. And so we really wanted to assuage a lot of those fears and concerns, and that it was take advantage of what you want to. No one is obligated to do more than what they're comfortable with, and so that was very important. The next was it had to be customized for us. So there are a lot of aspects of wellness programs that may not be relevant for us, right? Given our size, some of the things that we were able to accomplish. And then the third is it had to be sustainable. So, it was very clear that it couldn't be this flash in the pan. We really wanted something that had longevity, that we could keep going. And I have very supportive partners. And so we, as a group, with my sales pitch, they invested, they earmarked $5,000 in our annual budget to implement this. So I'm very thankful for that, and our staff are very thankful. And so some of the things that we did, we had a very multi-tiered approach, just focused little targets that we had. And hopefully, maybe you guys will come, hopefully come away with this with some ideas. You don't have to do everything, but even on an individual level, maybe you might want to do this. So one of the first things we did, we have very creative people in our audience, or in our among our staff members, and so we gave them a little money and said, hey, can we put something, just, we love visuals, we are a pediatrics practice, and we came up with this. So in each little flap, so everyone was given a little note card, and it said, what is wellness to you, and what is a personal goal? So, some of this is, I want to have energy for my kids, I just want to be healthier for myself and my family, and then some very nice, inspiring quotes in there. And what does this cost? $20 and a little bit of time, right? But highly effective. We also implemented healthy snacks at our office. We have just really big wicker basket at each office in the employee area, and we have one staff member who gets essentially like a Walmart or a grocery store gift card, and their job is once a week you go and get snacks for that office. And we also poll people, hey, what do you want? What do you want this week? We're in a rut with granola bars. We want some bananas, or how about if we try a trail mix or something? And it actually looks a little bit like that. So no boiled eggs, but we do have the apples and bananas, some yogurt, some other treats like that. Next is, and this is free, so we do have some drug reps that come into our office, and we really felt like we were prey. We're sitting here, and people are bringing us donuts. Ugh, that's not good. If it's sitting around, you guys have probably more self-control than I do, but if it's sitting there, you're going to nibble, you know what you do. You take out a little quarter section, and then you come back in a little bit, and then you pull off a little bit more. And so we said, hey, we appreciate your generosity. If you would like to bring something to the office that would be appreciated, here's a list of suggestions, right? So it sounds mean, but it's a donut-free zone. That doesn't mean we don't have cake for celebrations and things, but we just don't want it around all the time, right? And that's been highly effective. Another thing that we did is we implemented Walking Wednesdays. This is also free. So for each office, we used Map My Run. There are lots of other ways you can do this, but a safe, walkable 1 mile little trail. And at each office, and sometimes, I knew this would take off when some people would say, I miss Walking Wednesday, so I'm just going to make up for it today. And it's like Thursday. So they turned it into something else, like, tracking Thursdays or something like that. But so this is at one of our offices. So we took these photos on the same day. This is our one of our med students behind me. So we make them do it too when they rotate through our office, which I think is very cool. Something else we did. So this is potluck lunches. So everyone brings in an item. You have a little sign-up sheet, and to the left is that was like fajita, make your own fajita bar. Everyone just brings a little something. This was like a healthy sandwich bar. Just something to really get everyone in a communal atmosphere. You're sharing healthy food, and this has also been very successful. This is our wellness challenge. So, during our brainstorming meeting, we said, okay, what do we want to do? We it can't just be about steps, because, everyone's really good at counting steps. But really to help motivate people, that might not resonate with you, but maybe next month when we do Drink More Water Month, that might be something that you could do, right? It's feasible. We also have, like July was Try Something New Month that's health related. So, maybe you took a kickboxing class, or something that it's just a little extra motivation. There are some prizes associated with this. Last month, the office that won got a free lunch. With a caterer of their choice. Not extensive, but just something fun to reward participation. And that's all. It's not competitive. It's participation based. And one of my favorites is group yoga. So we have a yoga instructor, and for $75, she will do a private session, and she also provides like discounted sessions. So even if you're not doing this, at the organized events, you're welcome to come to her sessions. There's something different. So collectively, we did all this, but I really did want to make this kind of a tangible, what are we getting for this? What's the perception? And so in February, before we implemented everything, we did a survey, which we're good at, we love data. And the survey measured things like, what are your own thoughts about health? How does working in healthcare affect you personally in your health in your health choices, and then what aspects of a wellness program would you like to see in our program. And so, and then we culled that data, and then we also recently completed the 6-month post data, and I'd love to share some of that with you. So one is, how would you rate your overall health? So that was the question. And of the people who chose very good or excellent, prior to the implementation of the survey, it was 19%. And then afterwards, it was 41%. So perceptions. We also had between 60 to 70% response rate for both the pre and the post. Other things were, how does working in healthcare influence your health choice? It went from 26% to 50% who said often or very much. So that was meaningful. How conscious are you about eating healthy? It went from 29% to 42%. This is, I kind of like this. So how many days a week do you eat fast food? 1 time or less. Went from 27% to 42%. And then of the folks who ate 4 times or more, it went from 23 to 12%. This is probably one of my favorite ones. What are your barriers to eating healthy? Prior to the program, not enough money, 37%, and that went down to 25%. Not enough time went from 73% to 63%. Nobody was paid more and nobody got time off, but this is the perception. And then now I have no barriers went up to 33%. And so just, how many times a week do you exercise? It was, went up to 27% from 7 of people who exercise 4 or more days a week. And then, just a few more other kind of, interesting tidbits from the survey. But the ultimate thing is we had a lot of participation. So this gives you the percentage of people who participated in each of the activities in the past 6 months. So I would say very successful so far and easy to do. So, and lastly, I'd love to thank all the people here at the Canoff Institute, the Medical Society, the Leadership College, certainly, and my project mentor, Dee Dee Rowe, whom Rob put me in touch with, and she was fantastic, and gave some really nice pointers. So thank you very much, and I'd love to answer your questions.